Section 1 of the 9th chapter is an informal discussion with peer helpers from the Aspers Association in Lyon, France. During the conversation, they discussed category number 9 of peer support skills. This category, which includes 6 skills, consists of valuing communication. 1. Uses respectful, person-centered, recovery-oriented language in written and verbal interactions with peers, family members, community members, and others. The conversation highlights the importance of focusing on the person rather than the illness. Peer support workers often mention their holistic approach, emphasizing listening to the needs and goals of the individuals they support. For example, one of the speakers emphasizes, "The perspective that peer support can bring is that we, as former individuals concerned with our life journey, have done a lot to get through it." This method provides hope and demonstrates an ability to co-construct solutions centered on the experiences and aspirations of each individual. 2. Uses active listening skills. Active listening is a foundation of their practice. It not only allows for a better understanding of the needs of users, but also helps build a trusting relationship. Peer support workers describe their practice as being deeply rooted in dialogue and openness. The exchange fosters fluidity in relationships and allows for better mutual understanding. They also mention that this skill is sometimes absent in the training of healthcare professionals, which limits their ability to adopt a recovery-oriented approach. 3. Clarifies their understanding of information when in doubt of the meaning. When working in a team or with users, peer support workers place great importance on clarifying information. For example, a participant notes that they only consult patient records after meeting with the concerned individuals to better understand their perspective before possibly confirming the information through medical notes. This illustrates a collaborative and precise approach. 4. Conveys their point of view when working with colleagues. Peer support workers highlight their role as mediators between users and professionals. They believe that their experiences give them a particular legitimacy to positively influence teams. One peer support worker says that, "In clinical meetings, our voice often brings a different perspective on patients' needs. This interaction helps to break down silos in practices and promotes a more holistic view of recovery." 5. Documents information as required by program policies and procedures. Peer support workers emphasize the rigorous documentation of their work. This includes detailed reports of group activities and individual interviews. However, they highlight disparities in access to institutional tools, such as medical records, depending on the structures where they work. Often, access to the IT services where patient records are stored can be problematic, one of them says. 6. Follows laws and rules concerning confidentiality and respects others' rights for privacy. Confidentiality is another key aspect of peer support workers' practice. They commit to respecting current laws while raising awareness among their colleagues about the importance of protecting sensitive information. It is mentioned that users' trust relies on this confidentiality and that transparency about their role strengthens this relationship.